I think one thing that's really important for the future of radiation is being able to continue to optimize both the delivery and technique of our radiation to minimize the side effects both during and after treatment. I'm Dr. Katelyn Atkins, and I'm a radiation oncologist at Cedars-Sinai Medical Center. As a radiation oncologist, our job is really designing radiation treatment plans for cancers to deliver radiation in high doses and high energy forms, specifically to treat cancers. Radiation therapy can be used to treat cancers all over the body, and I focus on treating cancers in the gastrointestinal tract. The question of whether to treat something with chemotherapy or radiation or both sometimes can really depend on a lot of factors. Some of that is how sensitive a tumor is to a specific treatment, and sometimes it's on the flip side where it might be what are the side effects of the treatment. So, radiation might cause side effects that are different from chemotherapy that we might think about differently depending on the type of cancer, the age of the patient. The optimal combination and sequence of treatments with chemotherapy and radiation, or which comes first, or whether you do them together, really depends on the type of cancer that you have, the amount of cancer, the stage of the cancer, and where the cancer is. It might be that you have radiation followed by chemotherapy, then surgery. Sometimes you can start with surgery and then have chemotherapy or chemotherapy and radiation after. One of these could be the best option for you, and it really depends on the type of cancer, where it is, and having a discussion with all of the oncology doctors together. In rectal cancer, we now have a lot of options for neoadjuvant therapy. There's a term we use called total neoadjuvant therapy, or TNT. Basically, what this means is it's delivering a whole package of treatment of radiation and chemotherapy before surgery. Radiation can be delivered a number of different ways. For instance, for rectal cancer, it might be that you need 5 treatments of radiation over a course of 5 treatment days, or it could be that you need 5 to 6 weeks of treatments, daily treatments, and both of those can be very, very reasonable options. We've been using radiation therapy for cancer treatment for a long time, but in particular, over the recent years, there's been a lot of technological advances, from things like detailed CT imaging, MRIs that we can use to get a close look at a cancer, and being able to use that together with a lot of evolution in the technology to really take the treatments that we were doing in the past and really have modernized them to be more effective, safer, be able to treat more with more precision. We think of things like 3D conformal radiation therapy or intensity modulated radiation therapy, or IMRT. One unique form of IMRT is called VMAT, or volume modulated arc therapy. What that means is that when you're laying on the treatment table as a patient, the machine that moves around you is moving continuously in an arc. And as it's moving around you, it's delivering very specific amounts of radiation that might be changing at each angle to specifically deliver to areas of the tumor, but block areas of your body that we don't want the radiation. And what it means is that we're being able to deliver it with increased precision in quicker treatment times than historically done, because we're able to continuously have the radiation being delivered during that time. So proton therapy, or proton radiation therapy, rather than using photons or X-ray energy, it delivers it as a proton beam. The unique thing about proton radiation compared to photon radiation is that while photons, which are like X-ray energy, pass through your body, there'll be entrance and exit dose. Proton therapy can be modulated such that the energy will stop and not have exit dose on the other side. So this is a unique way of delivering radiation when you can minimize low and exit and kind of aggregate radiation dose elsewhere around the tumor. It's been most useful in showing benefits in treating younger patients, in children, people who have a long time to manifest toxicities of radiation over decades. Proton radiation is showing promising results and is being actively investigated in a number of cancers. So, immunotherapies and targeted therapies have been significant advances that really do impact all of the delivery of treatment, including radiation. Immune therapy and radiation therapy can synergistically work together. So, even radiation therapy might be able to break down cancer cells and trigger basically the presentation of different types of the proteins at a molecular level to the immune system that might help stimulate the immune response and might help stimulate the immunotherapy. And this is the work of a lot of active ongoing clinical trials looking at things combining small short fractions or SBRT or short courses of radiation with immunotherapy or even our traditional radiation paradigms with immunotherapy.